It's brilliant. It's actually an eye-opener. I really appreciate having this opportunity, and especially listening to Deb, the patient.
I really enjoyed the simulation aspect, so seeing a video of mental health staff in a kind of physical health crisis, not knowing what to do, and actually making you realise how important trying to fill that gap is.
Absolutely great. Lots of really interesting sessions that people are talking about education. I've put myself down for some of the training that's going into mental health and physical health.
Everybody here certainly seems to be thinking about people rather than the problems they present with in a holistic approach to care.
I think it's inspiring because it's looking to the future and the future of the services, and in these quite challenging times we're facing in the future.
I think it's brilliant. I've already made so many contacts with people that I otherwise would not have come across.
I'm finding it interesting, the different mix of people and different professions coming together.
I'm surprised to see literally hundreds of people coming along to talk about what is essentially a movement in the way that we need to operate in the health service moving forward.
I think it's very timely pitch. I think it will resonate with a lot of other people that I work with, and we're continuing to push it and to encourage our people to utilize and tap into the expertise that's been made available through Breaking Down the Barriers program.
Marrying both physical health and mental illness is the way forward, as obviously there's been a lot of divide and disparity between both sort of provision of services. So I think that's the right way to go.
We've been talking a lot today about parity of esteem, which is a really key point about the way in which a patient with a mental health and a physical health need can be kind of dealt with in a clinical environment, and actually training up the entire workforce to manage all of those scenarios can be nothing but a good thing.
If you don't have the training to do something, you're limited. And when you're limited, you realize you don't have the confidence to do things. So I think training is a very big issue, and it will help in breaking down the barrier.
I think what will really make this happen is organisational sign-up at the highest level, so a board-level commitment to undertaking this training.
I think we need inspirational leadership and also resource provision, but also an expanded integration between the CCGs and the Mental Health Trust, and for managers to know that they're being patient and clinician-led.
I think it's hard when you're working at full capacity to think about taking on new roles and responsibilities, so some space for people to learn and embrace it rather than be forced with another thing to put on their overloaded plates.
Communication, respecting each other, and especially knowing the services available, because unless you know what service is available, you can't refer your patient to that service.
And I really like the patient experience, keeping the patient's voice center at the discussion. I think that is one of the big ways to embed, because all of the practitioners want to look after patient and service user needs. So I think that's a really good thing to get people to stay at the table and engage in this.
We talk about nursing people holistically. That's exactly what it means. But if people still feel that's a mental health issue, so I don't need to worry about that, or that's a physical health problem, I don't need to worry about that, nurses need to worry about the whole thing.
Once we've demonstrated the effectiveness, I think people will continue to use it. Giving people a whole bundle toolkit so it's easy for them, I think will really help. And then at this geographical level, this SDP level, having a commitment from the top that this is the way forward, so that the organisation agrees to continue to use this tool for continued updated education. I am very optimistic, but I'm also not underestimating the amount of hard work that's needed to really get this embedded and to continue to push for parity of esteem of those with mental health needs. It's really important that people represent them.
As today's example showed, there are some leaders there who are able to provide the support and the guidance that is needed to drive the service forward.
I mean, there's a lot of little things we can do to change practices, and I'm so happy I attended today. I'm going to take a lot back to my colleagues.
We need change, and we need to facilitate it to make it happen.
Very optimistic, I can't wait.